good morning. Good morning to the peace loving people of Liberia. Good morning to our viewers. It is a great honor for us to be here this morning on our weekly edition of Health Talk. The Mama Alume Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals. It provides you with causes, signs and symptoms, complications, and preventions of diseases and illnesses affecting us in our respective communities. Our topic for today's discussion is depression. Depression is a common mental disorder. Globally, more than 264 million people of all ages suffer from depression. The prevalent rate of depression in Liberia is 20.2%. Depression is a leading cause of disability worldwide. It is a major contributor to the overall global burden of disease. Depression is just a problem in our country lately, and I think most of the time it is because of money issues, work stress, and like now, the impact of COVID-19 have put a lot of people in stress. Family and changes have occurred in their lifestyles. Some families lost their loved ones, and some of them lost their job. What do we do if we find ourselves in such a situation? So today, to those that are things that people really feel depressed when it comes to job, when it comes to losing their job, when it comes to losing the life of their loved one. So if we find ourselves in this situation, what do we do? Those are things that get people really depressed. So today, we're going to talk about depression. We'll discuss what causes depression, what are some of the signs and symptoms of depression, complications of depression, prevention, and support now. So we have with us in studio Mr. Dixon Kofa. Mr. Dixon Kofa is a mental health clinician, psychiatric instructor at the Greater Vision College of Health Sciences and Smart Institute of Management and Technology. He is a mental health supervisor for the St. Paul District, Musselrado County. We also have Ms. Marcy Munashim. Ms. Shin is an educator, member of the Girls SCS Liberia, a registered nurse, and she is currently doing her senior student courses at the Mother Patton College of Health Sciences in post-basic health sciences. To be part of the discussion, the numbers to call is 0770 107 107, 0886 107 107. If you are on Facebook, please follow our Facebook platform as we are shooting live now from the Hot FM studio. Please do not forget to subscribe to our YouTube channel and follow us on all of our social media platforms. So sit back, relax, and listen to this most educative health talk coming to you just after a short break. Do not touch that dial. I am Mama Alume, and this is Health Talk.
Begin at tunesliberia.com.
We are project. Liberia. Mama Liberia. Must all rise. Stand together to fight Corona.
Let's get to
Good morning and welcome back to today's edition of Health Talk. If you listen to my introduction, I said today we are going to discuss depression. And we know that March is a month of a woman, so we're going to dedicate this show strictly to women. We're going to talk about the different type of depressions, the signs and symptoms of depressions, and we're a little bit dive into the postpartum psychosis and that of the various kind and type of depression, especially when we're talking about postpartum blues and then postpartum psychosis. So I have with me in studio, or we have with us in studio, Mr. Dixon Koffer. Mr. Koffer, welcome to Health Talk.
Thank you very much for the second time in the studio and giving me the platform to speak to our people and to educate them on the broad discussion or what we'll be discussing that will be important for our people in Liberia. So thank you for giving me time.
Okay, and next to him is somebody that is not like strange to the show. She is my co-host and also one of the executive member of Girls Excels Liberia. She's also a registered nurse and she is a senior student at the Mother Pratin College of Health Sciences doing her post-basic health sciences. Miss Mercy Munashim. Miss Munashim, welcome to Health Talk.
Wow, thank you very much. You know, it's an honor again to be here. It's always, it feels good to be here on air talking about women's issue as it relates to health and how it benefits us as women. How, basic measures that can be put into place as it relates to women's health.
So let's start the ball rolling, Mr. Koffer. Sorry when I pronounce your name. Let's start the ball rolling. Let me start with you. Let's start with the basic, right? Because like when you talk about depression, people have so many views of depression, right? So what is the difference between like common stress and depression?
Thank you very much. Stress.
Yeah, common stress.
The common stress is the day-to-day activities. We have stress day-to-day activity. Even coming to the studio, we have stress, and we need stress in order for us to work. But persistent stress, it lead to depression, and depression it lead to it's a mood disorder that is characterized by persistent sadness and loss of interest in pleasurable activities for at least 2 weeks. So it's categorized. So for within 2 weeks, when you have persistent sadness and loss of interest in pleasurable activities, there are things then that you're doing, you're not doing it, and you have poor sleep, so it can lead to that. So for stress, it's a day-to-day activities, and we have to have stress in order for us to really work.
To get our daily activity rolling. So okay, then now come back to this. Then what causes this depression?
Now, if we look at depression, there are causes. Now, family history also too. Someone that is depressed, definitely they can pass on to another person. Another form is drugs. Drugs abuse also too can be a form of, it can lead to depression. And the environment, our activities and the environment, like we have people, if you loss of job, and we having in the marriage also too, if you a one mate that leave another person, you can have that. So these are very area or causes of depression, especially in our society.
Okay, thank you so much for just giving the difference between common stress and depression, because this is the thing that most people don't understand, that when they see common, they feel that the person is depressed, right? So thank you so much for making that explicit for the audience. And let us come to Miss Munashim. Miss Shim. So today we are talking about depression.
Yep.
How does grief different from depression?
Thank you very much. In the case of grief, it could be relative. That is, what is causing that person to grieve? Is it a marital issue? Is it a job issue? Or is it the death of a loved one? Or what is it? So there are a lot of factors when it comes to that issue of grieving or whatever. So now when it comes to the issue of depression, it is kind of the day-to-day function of that identical person, which could be hormonal. As we'll get on our day's discussion, we'll get to understand more about that. Yeah.
Okay. So let us go back to Brother Kofi. Brother Kofi, this May or March 8th was International Women's Days, right? And from my perspective, or from my understanding, I get to know that depression affects more women than men, right? So there are various types of depression, like the postnatal depressions, like the postpartum psychosis that can lead to depression. So, but just to take few, can you just take us through the various type of depression?
Thank you very much. And we have two types of major depression. We have major depression and the persistent depression. So for the major depression, which of course goes with loss of interest in pleasurable activities and sadness within 2 weeks. And these are activities. For the persistent depression, it go for time. It's chronic, but it go for time over 2 years period. Now, what happened? We say depression when it comes in family. We talk about family.
Mm-hmm.
It runs through the family. If a woman is pregnant, and what really interests me now, we're discussing about a topic, we discuss depression and mainly when it comes to Liberia, our setting will be talking about things that can make women to be, and they are very vulnerable to it.
Mm-hmm.
If a woman is depressed and they are pregnant, the possibility for that child to be depressed is there. Because if you are okay, you are happy, and the baby is also.
Sometimes it can lead to fetal death.
Thank you.
Of course.
You understand? So it can lead to that. So when you are happy, the child is happy. The food that you eat, the child eat that food also too. So the way you think, the way your feelings also have effect on the unborn child. So you see, so these are things that are really. Now when we talk about postpartum blues, postpartum depression, postpartum psychosis. So postpartum blues is a normal thing that a woman can experience, especially if you do a delivery and there's a feeling of being tired, and be having that form of fatigue. But we just take a short time, 1 to 5 days or 1 week. But now the depression will comes about if you got a sign and symptoms of depression within 2 weeks, wherein you have persistent sadness and loss of interest in pleasurable activities, fatigue, post-sleep, and loss of appetite. It migrate 2 weeks or above, it migrate to postpartum depression. If a person did a delivery or a woman did a delivery and experiencing these signs and symptoms, it means to say they having what? Postpartum depression. Postpartum psychosis will come in, wherein you have hallucination and that delusion. Wherein the woman be looking at her baby, she will see the baby in which, even when the baby go into the fire set, she will just allow the baby to go. There are other things that the baby will be doing, she will not want to engage, or even say beat on the baby, just like they are equal. Malnouring the child, and don't want to see the child. So depression, or the hallucination and delusion will come in. They will have false perception that child is the child and making them to be like that. So if you see these things, then you have it. And really, based on our economy and based on other activities, we have so many women, they are vulnerable to that. It leads from depression to postpartum psychosis. Another aspect, especially our young girls, you have to know about relationship. I can tell my students before you enter in it. If you don't know about it and this person come in with everything, that everything is bread and butter, what happened? After pregnancy, or you are pregnant, he leaves it. You start experiencing what? Depression. And why in medical we have something we call pre-eclampsia. Because you are depressed at that stage, even when you go deliver and you worrying, Why are other things you cater with the baby? All that stress is in you and month out to 8. You have pre-eclampsia, you have eclampsia in pregnancy. So after, if you don't resolve that, you do your delivery, you try to enter into what? Depression, and you don't take time, postpartum psychosis.
Thank you so much for that vivid discussion, giving us the various type of depression. So let us move back to Miss Munashim. How common is this depression in our setting, especially in Liberia?
Thank you very much again. When it comes to depression, how common it is in our society, one will look at socio-economic status of people. Those are one of the issues that affects the day-to-day life of a woman. Like my the studio girls are also saying that how the relationship status of a person when they get into it. And one thing when I say socio-economic, look at the person's financial status before even getting pregnant. Because the issue of 9 months is not 9 days. So going through the periods of pregnancy or the months of pregnancy, it can be very, very stressful. So if this person is not having a good financial backing, is not having a good social support, financial support, educational, maybe when it comes to education, because maybe if this girl was in school and she's not being fully cared for or her education is being disrupted, it also leads to that form of depression. So that's some of the issues that also affect it.
So generally, what is the clinical cause?
The issue
of someone who is being diagnosed with depression.
Someone with depression, the clinical cause is mostly I would say hormonal issues. They swing in the hormones.
Yeah.
Because we have two hormones playing role, the estrogen and the testosterone.
Yeah.
And your progesterone, sorry. So those hormones in pregnancy, what happens is that they are increased in hormones and the function of other hormones is being played on as well because of the presence of the pregnancy. So hormones do also play a major role when it comes to the clinical issue, which will lead to the person having constant mood swings, stress, like feeling abandoned and sad most often. So those are some of the issues.
Okay, thank you so much. If you are listening to us out there, the numbers to call and be part of this show is 0770 107 107 0886 107 107. So you can call and be part of the discussion. You can call and ask our studio guests all of the questions that you want to know about depression. You can also call and share your experience. If you have been diagnosed with depression before, you can call and share your experience and tell us what went wrong and what were some of the things you observed, some of the changes you observed within yourself. So the phone line is open 0770 107 107 0886 107 107. Okay, let's continue until we can get Carter on the line, till we can pause for a bit to entertain Carter. So Mercy, I come back to you. You were talking about like, okay, we have a caller. Hello, your name and where are you calling from? Oh my God, we lost that caller. So you can call up back again 0770 107 107 0886 107 107. These are the numbers to be part of the discussion. Call and share your experience, call and give your view, call and ask our studio guests all of the questions you want to know about depression. So I'll come back to you, Mercy. You were talking about several factors that can lead to depression. Like, I just want you to go over that a bit because
yes, I was talking about factors that lead to depression. One, I said socio-economic issues.
Yeah.
Given our current status of the economy, there are a lot of people that
Good morning, and your name and where are you calling from? Good morning, your name and where are you calling from? We got another caller. Let me try that. Good morning, your name and where are you calling from? Oh my God. So I don't know what's going on. The numbers to call is 0770 107 107 0886 107 107. Marcy, you are saying something.
Yeah, we're talking about people. Some people are not
You're
giving.
talking about financial issue.
Yeah, financial issues. So some people get pregnant, they have no strong financial backings. And two, people having history of family history of depression, as my colleague said. Because when this issue of depression runs in the family, because where the woman is pregnant, gives birth to children, the children grow up with the issue of depression, and it's already in the family line. These are some of the things too these are some of the factors too affecting the condition. History of it, the socio-economic factor, the lack of adequate social support or psychosocial support. These are some of the things that.
So how does that relate to what impact does that have on young girls and women in Liberia?
The impact is that most of these girls who carry these pregnancies or are successfully giving birth to these babies are not able to adequately care for them. Because
one single parent.
Yeah, one in the issue where they are not married, and like I said about the issue of finances, that play a major role. How do I care for this child? Because I'm no longer alone. She was living with parents who could barely care for themselves or even care for her fully, and now she is pregnant. It's a serious issue. So it becomes kind of like, how do I care for this child? How do I even care for myself? So if you look at girls with those kind of with those babies, at the end of the day, the nutritional status of that child is affected, the physical well-being is affected, and all of that.
So, Brother Kofa, what are some of the risk factors?
Thank you very much. For depression, some of the risk factors include now you have other illnesses, especially if your immune system is breakdown, you are vulnerable. Depression is no exception to it. You have other conditions, other medical conditions, even malaria, because your immune system is breaking down and you are prone to this condition, typhoid, and the list is endless. Because the issue about depression, if you are breaking down, you are vulnerable. These are risk factors, and if you look at what you were discussing or talking about, the issue about men, they will not want to, because the way the men play on them, they will not even say want to trust men. They will not want to have any other activities. Yeah.
Good morning, your name and where are you calling from?
I'm Pastor Patikuma Kruma. I'm calling from Ghana.
Yeah, Pastor Kerman.
Yeah.
Welcome to Health Talk.
Okay. How's everything? How you doing?
We are okay. So we are discussing depression.
Okay. Yeah. Normally, depression is not something that someone can fight because sometimes when you are depressed, if you're not taken care of, you don't have people that be able to get around and talk to you. It could even lead to suicide or other. So I think if someone is depressed, they need to find someone at least that can be able to talk to them, so that they can be able to overcome the situation.
Okay.
Because depression is not really a good thing, for our health.
Sure.
Yeah.
Okay. Thank you so much. Thank you for adding your voice to the many voices in studio. Thank you so much for being part of the show.
Okay, welcome.
All right.
So like we were saying, we said depression lead to so many other conditions, especially medical conditions. Then you see poor health. For example, your nutritional status also too. Because if you don't eat and we say lack of appetite and you decrease in energy, and it make you, like the caller says, suicide. Yeah, you have some suicide ideation. And any person that had depression, you should screen them for suicidal thoughts. And it is very much key, because the Christians say Adoma is a devil workshop. So if you are sitting and you don't thinking on positive things, you just thinking on negative things, because what happened to you, that low self-esteem, it brings a whole lot of negative thoughts, and you have lost in concentration.
You feel that you are not even part of
You don't-
society.
thank you.
Like
Exactly.
your life, everything have just come to an end.
to an
Like
end.
most people, that's the time they think about suicide.
Yeah.
Yeah. Okay, thank you so much. If you want to be part of the discussions, the numbers to call at 0770-107-107, 0886-107-107. So you can call and be part of the show. You can call to share all of your experience on depression. Or you can even call and ask our studio guests all of the questions you want to know about depression. Mercy,
Yes.
back to you. What are some typical, oh, we lost that color. You gotta keep trying, keep calling the line, the phone lines is open, 0770-107-107, 0886-107-107. Keep trying. What are some of the typical family related issues that lead to depression? Because like you were talking about financial crisis, like when you
Yes.
have a fiance. Well, let us look at the family link, like between mothers and child, like between two parents, because there are some family issues that can lead to depression, right? So I just want you to go over it.
Yes, you see, when it comes to the issue of depression, it's very key. Family members should play a major role in that. If they observe changes, basic changes in their relatives, physical or social activities, sometimes because people mostly with depression will withdraw. They will have that withdrawal symptoms. They will stay away from social gatherings because they no longer their self-esteem has been tampered with because they having suicidal ideations, they having like I'm no longer fit to be around these people because life has failed me. So when it comes to the issue of the family plays a key role in helping their relatives to be able to get back on their feet, even though there will be other medicinal or other health issue coming into play. That is, health practitioners will come in with other safety measures or with other medication be able to enhance the daily or the livelihood of that person. But the family should play a major role in helping their relative with this issue of postpartum depression to be able to recover. Because women who are in this kind of state will no longer want to breastfeed their babies, will abandon those children, like Macaulay was saying about the issue of the child being weak and all of that.
Good morning, your name and where are you calling from? Why today we keep losing our caller almost? What's going on? You guys need to keep calling. I don't know what's going on actually. And I can see everything is said here in studio. I don't really know what's going on. Keep calling. Good morning, your name and where are you calling from? Oh my God. I don't know what's going on. Actually, I don't know what's going on. But you can still keep trying. The phone line is open. Keep trying. Keep sending in your calls. We were talking about some family related issue. Let's take for example, you get a child and this child is going to school, which of course we see like most teachers, most family, they don't educate people like on menstrual cycle. And unfortunately, this child is, let's say, in the 10th grade, and then when you gotta realize that you pay the child school fees and everything, the child already like pregnant on you to you, right? Like you pay the first semester school fees and everything, you buy uniform for your child, you send your child to school. Before the child will say first period, the person is pregnant. So in cases like this, most of the time you see depression come in two ways. The family, the mother of the child will feed it, and that child too will feed it. So what advice do you have for parents, and what advice do you have for young girls listening to you?
Thank you again very much. The thing is, it's so disheartening for a parent to labor so hard for money, sending your child to school, only to hear at the end of the day instead of receiving good grades, the child comes home with pregnancy. It is very stressful. That mother goes through depression. She feels that society will say she has failed on the child. But still, it should not be a deterrent. It's going to hurt you. It's going to break you down. You're also going to feel depressed. But I will urge you on this day, as a mother, to be able to encourage that child. Because she has made this mistake, you need to help her. She needs your support in a crucial time of the pregnancy.
Good morning, your name and where are you calling from? I don't know, oh my God, I don't know what's going on today. I don't know. It's really giving me like, I don't know.
Yes. So for us parents, we have to educate our girls. When we know that they have entered puberty, beginning from 9 years old onwards, we should have to tell these girls about menstruation, how to control it, what happens When a woman starts to menstruate, her risk of being pregnant, or what predisposes her to maybe being pregnant, having male friendship and encouraging sex at an early age, these things has to be taught. I know sex in family is not an issue, it's not an easy discussion to be talked about between girls and a parent, or between her mother and herself.
Especially in our African
In our
setting.
African setting, but it has to be talked about. That's why we have many cases of teenage pregnancies around. So the mother play, or the parents play a major role in helping that girl to be able to go back to school or even stay in school while being pregnant, because she needs family support to be able to help her through the process.
Okay, Mr. Kofi, I'll get back to you. What are some of the complications? Depression.
Like I think we discussed previously, when it comes to the complications, like for depression, now we have issue. We have medical issues associated with it, and these are complications for depression when it comes to it. And you'll be weighted down, and there are some signs and symptoms. Like for example, someone will be, they will say everything all around your body, everything is hurting. Especially a depressed patient, we have that false perception that something is happening to them, which of course it is not. They will have it. And there are also too.
Good morning, your name and where are you calling from?
Hello, I'm
Good-
the number.
Yeah, Mr. Nambi, welcome to Health Talk. Welcome to Health Talk.
No, actually, I'm mistake. I'm sorry.
Pastor Nambi, he said a mistake. Okay, I'll continue.
So the complications when it comes in, we talk about the medical complication, and there are some other, like for what we discussed, the suicide also too. These are complications because the person is depressed, and being depressed is another thing, and having that false perception, not seeing the reality is another thing also too. I will look at, and the person body will be draining. Like what my sister was discussing, if a person, like you have a girl that go to school, and every parent will want to expect good out of their children. That is their goal. That is their expectation. Now, when these things happen, especially she go get pregnant, what happen? Even the mother and father will have little bit of confusion in the home. The father will even want to put it on the mother, and the mother say it is not her, and it can bring misunderstanding, and they can actually feel bad because they are looking at their neighbor or children, they are struggling, they are getting education, but there is a setback. And I can tell a parent, don't expect your child that you have will do something for you tomorrow, but you should do something for that child. But just in case the child turn around, that's a depressed mood that you'll be in. You'll even be frustrated, and there are other things that you enter into. So I can tell them. So these are things then, especially when depression comes, you see all these things, especially in your adolescent period. It is a critical stage that the adolescent youth can be in. So as a parent, in order to control them during that adolescent time, it's a difficult time that a parent should really be able to control them, because if they sleep, it will be that negative. So the parent should be able to sit with them and discuss what they think they will meet it from. Because when they don't discuss it, their friends will show them it, and other different people will show them it. So they should be practical in their approach.
Okay, thank you so much. So it's always good to talk with your children. It's always good to educate your children, especially on the basis format of life. When it comes to menstrual issues, when it comes to sex relationship, always educate the child, because when they learn it from their peers, they're going to maybe like become wider, even more than what you expect of them, right? So if you're finding it difficult to come through with the 077-107-107 number, you can also call on 0776 602816. So the phone line is open. You can keep your call coming. I don't know what's actually happening, so we just changed one of the phone. So you can call us on 0776 602816. Right? So the whole depression issue, when you look at Liberia, Are people really aware of it?
Liberia is now Monrovia or Montserrado. So the issue of depression, people don't know, really understand it. Sometimes they will attribute it to witch activities. But I just some key points I wanted to state before going further with that question. One, the issue of postpartum depression, which goes about for 2 weeks in some women after delivery, because it usually happens after the delivery process, also not during the prenatal period, or the issue of the crisis comes in after delivery, mostly when they leave the hospital facility or even within the hospital facility it happens. So the period lasts within 2 to 6 weeks. In some people's not in even extend up to 6 to 12 months in girls. But it is not only women alone or girls that is affected with the issue of postpartum depression.
Okay.
It also affects men or boys who is the first time also having kids.
Okay.
It affects them as well. The issue of the postpartum depression. I know men don't go to get birth, but it also play a role on them wherein they are not used to having babies cry at night. They're not used to having short sleeps or irregular sleep. It affects them. So we mainly focus on women, but it affects men as well.
Okay.
Yeah.
Brother Kofa, because time is fast spent, we almost going to the end of this discussion. What are some of the preventive measures when it comes to depression? What we need to do as a institution, as a country, to see how best we can at least minimize, because it's hard to get rid of it. We can at least minimize it in Liberia. What are some of the things we need to do?
Thank you very much. Before going further, we need to look at the treatment aspect also too. Then we go to that of the preventive aspect. So for postpartum depression or for depression as a whole, we have our treatment. And for the moderate depression, there's a talk therapy. And talk therapy, we talk to them. That's what we need to do. And in the talk therapy, we have something we call CBT, cognitive behavioral therapy.
Okay.
The negative perception, how can you change it to the positive ones? So it will need a counseling skill that you need to do in order to do that for the moderate level. Motivational therapy also too, interpersonal therapy, how you are dealing with the patient also too, it matters. Now when it's depression is severe, we have other medication like anti-anxiety, antidepressant, and even when the postpartum psychosis come, we have to get antipsychotic medication to calm it down. So these are medication or therapies or treatment that we can give. And how can we prevent it? Now there are things we need to know about things before entering into it.
Of course.
So as a girl, if you are coming up, whatever relationship you know you want to enter in a relationship, what are things that need to put together in order for you to have a meaningful relationship? So you need to know about something before engaging in it. And there are some things that we don't engage ourselves in. We need to set our limit. We need to set time. For example, you're talking about having children. What do you think? How many children you think you want to have? If you got one, how many children you want to have? You got school fee for them? You got other activities? So you don't born a child or have a child, you say this one will go live with my sister, this one will be with my brother. When the brother or sister
Have
refuse
their
it,
own family too to take
then
care of.
why you think? So you start having these things then, and coming on you, and you are getting all of family relatives, making your family, increase, but you don't have enough means to do that. And we should have a balance. Whatever we are doing, we should not be competing with people out there because this person have it, so you want to have it at all costs.
Sure.
What you think you should have, you should be able to manage it.
Okay.
And we should expect things to happen to us. We should expect things to happen.
Once
We
you
don't
are alive,
control it.
you should expect the uncertainty,
Uncertainty
you
to
should expect
come.
like positive, negative, all these are part of
Yeah.
human life.
So when it comes, how we can we
How
manage
you cope
it?
with it.
How can we cope with it? And if we have it, we need to go to people or clinicians, mental health clinician or other counselor that will be able to help us, or especially in the mind and moderate.
Okay. Thank you so much. So, Mercy, Let me get back to you for your parting comments in that of your closing statement. But before we move into that, I just want you to give like for 2 minutes, like what advice do you have for young people, especially young girls that are coming out today into the real world? What advice do you have for them? Because their expectations are large. So what message do you have for them when it comes to depression?
Yes, thank you very much. Firstly, I would like to attack the issue of the family. I would like to address that because, you know, the family plays a role in the upbringing of girls. We have to talk to our girls about pregnancy, about sex. It's not an easy thing, but we have to talk about it. We need to talk to them about it. So if our girls who have gotten pregnant has given birth to babies, and we are seeing some of these signs that are listed, we need to often take them to the hospital where they will get checked and counseled by a licensed health worker that is going to meet their basic needs. So, but the family too have to play key roles to avoid these things. When we talk about the preventive aspect, we need to prevent things. We don't have to wait for it to happen to us before we start to work towards it. So family need to put their house in order. We want to help our girls. We need to talk about these issues. I know even if we talk about sex with them, it's not going to stop them, but they're going to have basic knowledge on what it means to get involved with a boy, especially when you are not prepared for a child. Because being a mother is not only about carrying the pregnancy or having the baby in your arm every morning. It's about being physically, mentally prepared, financially prepared, and all of that. So the family plays a major role in this. And our society, Liberia, or the world at large is being really threatened or is being really hampered by the issue of teenage pregnancy and depression among young girls. So my kind advice is, or my kind words to you out there is, please, young girls, women, let's talk to our daughters. Girls, put yourselves together. Know what you're getting into. There are other safety measures out there that you can practice, even if you want to have sex. So thank you very much.
Thank you so much. So, Mr. Kofa, can we get your closing comments?
Thank you very much. At least the time for educating our people, especially when you look at depression, it's one of the main things that is eating up Liberia, especially youth. Now, what we need to do is that, please, you are encouraged to go to school. Not only maybe letter school, but other things. You got other activities like baking, like being innovative. Yes, being innovative, and you try to get something for yourself. That even that relationship that you with, the next time relationship they don't want you, you know what you're standing on. Because if you don't stand on it and you just make your whole life run around or your boyfriend or man, it will lead you into it. And definitely when you say I'm not doing it I'm not doing it for you, you see where you get it, then you start thinking where you're going to get it. Then it will lead you, you will try to think about so multiple partners. So it is important that we go to school and try to learn and help yourself. That tomorrow you'll be able to help yourself and help the kid that you have. At least it will be okay. So thank you for the time, and thank the Hot FM family for giving the time to discuss when it comes to depression in Liberia.
Thank you so much to our studio guests or our studio panelists for educating us on today's edition of Health Talk. We are so happy and we appreciate your coming. We would like to take this time to appreciate the Hot FM family for always supporting us, being part of our health education's activities. And we also want to say thanks and appreciation to our Honorable DJ Blue for alerting us time in studio to always educate our people on their health. Thank you so much. Thank you to everyone. Thank you to those that were watching us on live. Thank you to our listening audience. And thank you so much for being part of the discussion. To all of our callers, to those that called that they couldn't reach us through, thank you so much for calling. Don't forget to join us next week, Thursday, same time, same studios, on another edition of Health Talk. I am Mama Elu.
Speaking at tunes like Beard